Specifically today, the aims of the session are to bring together small countries participating in the initiative to articulate a shared forward-looking vision. This includes identifying the most immediate areas in need and short-term health priorities for a fair recovery, and to reflect on common priorities for the medium term by taking into account national health plans and using the European Programme of Work 20 to 2025 as the overarching guide and umbrella. A couple of pieces of information before we start. I'd really like to draw our attention to the Slido function, through which we encourage and invite you to submit questions as we go through the session. You can use the hashtag small country RC71. In the interest of time, we'll address questions, as many as we can, during the final discussion, which my colleague, Dr. Bettina Manning, will facilitate. So without further ado, I'd like to now hand over to the Regional Director, Dr. Hans Kluge, for his opening and setting the scene. And Hans is a huge supporter of this initiative. Hans, please.
Thank you so much, Chris and Bettina, and all colleagues and friends. When we last met to discuss the next steps in achieving united action for better health in the small countries in the WHO European region, I asked the 11 member states about the lessons they drew from COVID-19. Their answers singled out key points that are already shaping WHO Europe's direction. Featuring prominently was international solidarity and solidarity across borders in the context of vaccine access, dependency on other countries, affordable medicines, supply chains, production capacity, and mobility of health workers. While COVID-19 has reminded all 53 member states that no health system can survive unless it has a strong health workforce and primary health care, this has been particularly felt by small countries. The draft roadmap for better health in small countries 2022-25 captures this. And let's recall the objectives. Keep health high on the political agenda during the recovery and beyond. This was the impetus to develop the Pan-European Commission on Health and Sustainable Development, the Monti Commission. Second, advocate for the needs of small countries at the regional and international level. And we have been standing together in this issue of access to COVID-19 vaccines, now also on digital certificates. Then third, promote investment in an economy of health and well-being. And fourth, build a solution platform for better health and resilient health systems. I believe that the draft roadmap is an instrument to implement the overarching EPW, European Programme of Work, reflecting a range of concrete action points for small countries. Some of the most important and crucial ones for smaller states being access to medicine and innovation, also reflected in the Oslo Medicines Initiative. Remember, there was a session on this yesterday. Another hugely important issue for smaller states is long-term human resources. We just came out of the ministerial briefing on sustainable workforce this morning. It was a great session also, a lot of participation. Attracting, training, and retaining health and care workers is a hugely important issue. And here I would like to invite you, representatives from the small countries, to join us in pioneering ways in which investments in digital technologies can lead to new ways of shifting tasks, complementing scarce human resources and leveraging opportunities within artificial intelligence, for example. The Small Countries Initiative has and will continue to lead developments on healthier population and the well-being economy, addressing healthier tourism, equity, and how to best fight environmental and climate challenges. The recommendations of the Pan-European Commission on Health and Sustainable Development, the Monti Commission, also need to be taken into account and adopted through the lens of smaller states. The Maltese have a saying, L'essenza fil flickering is agar, which translates, the best essence is found in small bottles, or small is great. Keep in mind that in the context of building forward better, small countries may be able to reinvent themselves faster in the recovery ahead than bigger countries. That said, we have a lot of work to do, but as always, I find a lot of inspiration in the meetings of the small countries initiatives. Thank you so much.
Thank you very much, Regional Director, Excellencies, colleagues. And Hans, thanks for highlighting the importance of the Small Country Initiative and the way on how you are behind since a long time. Thanks for this. I now would like to invite Dr. Natasha Azzopardi, Director of the Division of Country Health Policies and Systems, to take the floor to briefly introduce the joint discussion we have been having with the small countries representatives on building the draft roadmap on supporting better health in small countries in the WHO European region. Natasha, the floor is yours.
Thank you very much, Bettina, and thank you for the preparatory work that you and the colleagues at the Venice office have been doing for this meeting, as well as for preparing the draft roadmap. It's very much appreciated. Of course, as the regional director knows well, the Small Countries Initiative is an initiative which is very close to my heart. And you have already heard outlined how we intend to continue to support you going forward based on what you have been telling us during the dialogues that we have been having over the past weeks and months. But coming straight away to the next slide on the objectives, as has been highlighted, it's very important to keep health high on the political agenda. And I always say that small countries are often able to anticipate the realities that are taking place on the horizon, maybe a few weeks, a few months before other countries, just because of the interconnected nature that, if you wish, news travels fast, change is immediately visible. And here, one of the things that is worrying us is that immediately after the worst of the COVID pandemic would be behind us, that people would say, well, the past 2 years have been all about health, it's time to focus on something else. When in fact, if we have learned any lesson, the lesson that we have learned is that we need to ensure that we have strong health systems, that health and well-being is really at the top of the agenda if we want to have prosperous, stable, and secure societies. And we have been hearing from the small countries already the need to ensure that health remains at the top of the political agenda during the recovery process to really help us shape a better health future. The second thing is, I think the pandemic has magnified some of the needs which we knew about before the pandemic, but became increasingly evident, increasingly obvious, including dependency on global supply chains. And also, we heard just in the ministerial health briefing earlier, the dependency even on a health workforce from outside the small country itself. Thirdly, really promoting the investment in the economy of health and well-being. Again, this is somewhere where the small countries can really lead the way, also in ensuring that no one is left behind, because you have the pulse on the finger, you're really able to capture the needs of the whole population. And in a way, it's almost inexcusable that in a small country, we leave people behind. So we need to find those ways to ensure that we don't do it. And of course, the solution platform is basically the way we come together, we exchange views, and we can provide ideas that can be even then of wider relevance to other countries in the region. So, coming to the next slide, the first priority is, of course, sustained COVID-19 response and recovery. And we know that many small countries are still dealing with many aspects related to COVID-19 response and recovery, not least, for example, issues around vaccination. We've also learned about the vulnerability of small countries in a pandemic, about the need to really make sure that there are robust agreements in place for access to PPE, to medicines, to supplies in times of emergency. Moving then forward, universal health coverage. What have we heard about? In our technical day, we opened with a session on strengthening primary healthcare. And yet we know that the experience of primary healthcare is very contextualized, very unique, and that in some smaller countries, strengthening primary healthcare perhaps was not often seen as a top priority or as a necessity. And the pandemic has really changed this, and I think that we are all convinced that even in small countries, the need to strengthen primary healthcare is undoubtedly a priority. Health workforce, we have been working already for 2 years within the Small Countries Network. We will continue to support the work through the initiatives that actually we presented just around an hour ago during the ministerial briefing. The Oslo Medicines Initiative, please engage. This is not only about the big countries, it's actually very much also about the small countries. And I think that the Small Countries Initiative together can play a very active role also in the work that we are taking forward in the Oslo Medicines Initiative. Regional director spoke earlier really about the innovation of digital health. Why is digital health important? Digital health is important if it enables us to achieve our goals of improving access, improving quality, improving efficiency, improving sustainability. And I think that within a small country context, we can have these demonstrable results because some people often challenge us too and say, okay, there's all this talk about digital technologies, but what do we gain out of them in the end? And I strongly encourage the Small Countries Network to actually be at the forefront of being able to document the results that we can achieve through smart investment in digital technologies, not least to ensure access to expertise that may not be available, but also to complement the health workforce. And finally, mental health issues, I think, irrespective, because again, we often hear that small countries have very good social cohesion, so perhaps they have been able to buffer even in the times of the pandemic, but we know that mental health is really on top of the agenda for everyone at the moment. What can small countries do? Small countries can really put mental health at the heart of their recovery through this health in all policies approach. Coming to the next slide, promoting health and well-being. Here, there are 2 areas that we have discussed in the bilateral sessions that we have had. The first one is rethinking healthy tourism. A number of small countries are very dependent on tourism and have really suffered economically and socially during the difficult months of the pandemic as a result. But here it's not about building back better, it's about building forward differently. How can we ensure a more resilient, more sustainable, more healthy tourism industry, also which is better equipped for any future health emergencies that may arise? We have often heard that we are going to be entering an age where emergencies and pandemics become more the norm, and therefore it's also really an opportunity together to rethink healthy tourism, and this again can be an example for larger countries to take up in due course. Which leads me to the second point, which is around climate change, again linked very much to emergencies, but also linked to the point that when it comes to climate change, small countries were the canary in the coal mine 20, 25 years ago, and now everyone is talking about climate change. And this goes to show that we can really be at the forefront and make a difference. How? by working together politically, yes, in order to ensure that there is a strong voice, even now, as we heard, as we reflect on the recommendations that have come out from the Monti Commission. And it's very important also that the small countries, your voice is heard during the deliberations that will be taken forward, not least around the governance mechanisms that will be established to keep health on the agenda. Technically, I think we have outlined the agenda. Of course, to be able to do this, we also need to resource the network. And that is something that we need to continue talking about in the coming months. But that's all from my end, and I hand back to Venice.
Thanks very much, Natasha. I think you really splendidly lined out the content of the draft roadmap. I now would like to open the first panel. We have 3 panels, the first one on emergencies, the second on universal health coverage, and the third one on healthier populations. So I now would like to invite the first group of panelists on the protection from health emergencies, which are Ms. Elena Mas Santure, the Secretary of State of Health of Andorra, Professor Neville Calleja from the Ministry of Health in Malta, and Dr. Claudio Muccioli, the Director of Health Authority, San Marino. Colleagues, friends, I have the following question for you. What are your country's needs for COVID-19 recovery? And how can the Small Country Initiative best support you and your country? I now would like to ask Ms. Santure from Andorra to provide her perspective. Ms. Santure, please take the floor.
Thank you very much, Regional Director, Excellencies, authorities, ladies and gentlemen. First of all, I would like to thank you for the opportunity to address my speech in this. Since the middle of the year 2020, the government of Andorra set to work on a comprehensive plan for the recovery of the health, social and economic crisis caused by the COVID-19 pandemic that led to the construction of a resilient society with high levels of health and well-being and sustainable. We call it Horizon 23. This plan is inspired by the United Nations Sustainable Development Goals and the guiding principles of the European Union and values that we share: transparency. The plan is based on 3 basic pillars: welfare and cohesion, alliances for change, economy and innovation. Each of these 3 pillars are developed in initiatives, which in turn are confirmed by a set of actions. I will focus on the pillar welfare and cohesion, which develop the following initiatives and actions: environment, social protection, health, and education. It should be noted that other pillars also contain initiatives and actions that are directly or indirectly related to the field of health. For example, in the pillar Alliances for Change, we find initiatives such as digital transformation, optimization of resources, and initiative international relations. We are looking to develop an adapted and leading health system. With this aim, a national contingency plan is being drafted. A national epidemiological laboratory is being developed and structured. The area of health promotion, prevention and surveillance and the hospital are provided with sufficient enough human resources. Development of specific programs, in particular relating to mental health and addictions. We also are strengthening a powerful and adapted health information system. We are also working on digital health, the digitalization of the user relationship with the public health system. We must develop this plan considering the lessons that we have learned from the COVID-19. First, like many other countries, we were unprepared and therefore we needed to do a review of our compliance with the international health regulation and implement the recommendations issued by the RSI Review Committee. One of the things we haven't was a state of alarm and emergency act. The government decreed the confinement of the population and the shutdown of the economy without this tool, which was approved 15 days after. But we want to highlight that we never had to implement it. So we are aware that, and we also learned that we have an invaluable capital, the trust of our people, who have followed the recommendations of the government without the application of the start of alarm. Secondly, we had also difficulties to the supply of PPE, and also we did not have the structures prepared for the response. Luckily, we were able to be advised by experts, and we were also able to follow the recommendations emanating from the WHO and by countries that were a step further, that had functional structures or in which the pandemic was in different stages. The contingency plan that we are developing will collect what we have learned, what we have put in practice during the pandemic, and it has worked, and also has not been useful. And we will also be guided by the principles of the recommendation of the European Commission on Health and Sustainable Development and the European Work Plan 2020-2025, which assumes the SDGs and the guidance of the 13th WHO Global Work Plan. In addition, we want to contribute to achieving the goal of 1,000 million people more protected against health emergencies. And we cannot forget the two principles that have been widely repeated since the beginning of this crisis and before. Don't leave anyone behind. No one will be safe until everyone is safe. These principles emphasize the need for solidarity. Andorra has been involved from the outset in the COVAX mechanism for the acquisition of vaccines and to step them reach affordable prices for middle and low income countries. And we also want to participate in the ACTA platform for the development and distribution not only of vaccines, but also for the diagnostic and therapeutic means and for the strengthening and health system. But solidarity can also start by being attentive of the countries that are part of the SCI. It should not happen that one country could not access to vaccines on equal terms with others. Between us, we should stay together so that the recognition of vaccines, tests, and certificates is real and everywhere. Many of us are heavily dependent on tourism and trade, so it's important that we are recognized and safe tourist destination, and at the same time that our citizens can travel to other countries with minimal obstacles. To finish, we have all received the SC roadmap to be developed in the coming months and years. From Andorra, we believe that it is positive and worthwhile to follow this path of cooperation, and we had already begun to draw it on Horizon 23 in some of its pillars, initiatives, and actions. Last but not least, Andorra has, by assent, like many other countries in the European region, support initiatives that should lead to the strengthening of the WHO so that it can effectively lead to the way to the 3,000 million with political and economical independence. And it will continue to do so when the time comes at the World Health Assembly next November. Thank you very much for your attention.
Sorry, I was unmuted. My apologies. Thanks so much, Ms. Santore, for this vision from Andorra and for your excellent collaboration from Andorra in the Small Country Initiative and with the World Health Organization. May I now turn over to Professor Kaleya from Malta to get the vision on the perspective of Malta. Neville, the floor is yours.
Thanks for the opportunity. Indeed, I believe the regional committee, the meetings this week have been focusing a lot on lessons learned. And haven't we had some of those lessons the past 18 months? And I think we're all much wiser now than we were in January 2020, I'm sure. both personally and also as countries. I think if there has been something that we have been celebrating pre-COVID, which was small country resilience and flexibility, that has come in very, very handy in our management of the COVID pandemic. And we hope that the lessons learned can be integrated in future plans, as I'll try to discuss over the next few minutes. So Malta's strategy in approaching the pandemic has been focused on, as much as possible, community intervention. So there was a lot of investment at public health level with a view to achieving three specific objectives. One, hospital, which is one hospital here. We can't send patients to the next region. We can't send hospital patients to the next hospital. We had to keep it not overwhelmed. Okay, we knew that if a patient cannot access ICU, we're effectively signing their death certificate. So we knew that was a priority. So that's priority number one. Priority number two was not to shut down elective healthcare, or rather to shut down elective healthcare for the least possible time in order to avoid the second, third, fourth wave as described by Dr. Tseng famously on Twitter a few months back, on NCDs, on mental health, to try and reduce that burden as much as possible. And thirdly, because health does not exist in a vacuum, but it depends also on the rest of the country functioning as best as possible to avoid having to institute lockdowns. And in fact, Malta has never instituted lockdowns throughout the pandemic. We were closed at one point, but we never instituted lockdowns to control the pandemic. That said, with the approach employed, the positivity rate in Malta has never exceeded 7% throughout the pandemic. And we're quite proud of this fact because we're aware that several other countries, most of them larger than us, of course, have had much bigger spikes in positivity rate, up to even 50% sometimes. Challenges we've encountered, I believe my previous speaker has alluded to several of these as well already, and also the regional director, procurement, like everybody else. I think I could write a book with all the adventures we went through to procure medical supplies, especially in 2020. The experience we have had through joint procurement, we're lucky in a way to be also part of the EU joint procurement for vaccines. And that has proven to be very, very providential for Malta. And I think it's one main driving factor behind Malta's success with the vaccination rollout. HR, so health workforce, we had two particular challenges, if I may. One was the challenges when it came to retraining workforce to do other duties that maybe they're not accustomed to, like manning ICUs or manning respiratory wards, COVID wards. Most of us had to create their own resources for retraining, which is a pity really, because this is an area we could have collaborated on. Secondly, was the loss of workforce. So we have experienced poaching of workforce, health workforce by other countries from our own supply. Admittedly, this affected more the foreign workforce, the migrant workforce that was already working in Malta. And this happened, obviously, needless to say, when the pandemic was spiking at its worst last winter. So this is something else to consider. Dr. Atsopardi-Muscat mentioned primary care, indeed. We can't agree more. And the discovery of the opportunity. Sorry, yes.
Dr. Kaleya, I need to put a limit to the 5 minutes, which are already, because otherwise we do not have everybody allowed, at the time.
I will conclude.
Thanks, sorry,
Bettina, apologies.
Yes. Mm-hmm.
So, one other challenge for small countries, and I think other colleagues agree here, was keeping up with the data requirements, both international and domestic, and the rapidity that such data have to be produced with. So that's another challenge we might have to look into. The dependence on travel, it has already been mentioned. It affects us small countries much more than larger countries because we get more arrivals per capita. So even analyses that happen at international level need to take into account the specificities of small countries. Conclusion, for example, that importation of cases does not affect the local epidemic situation was definitely not our experience here in Malta. And lastly, again, lessons learned, the collaborations that we have set up, I think the contacts we have set up with other sectors in the country will definitely prove to be useful in the future. And if we are planning for future healthcare emergencies, we definitely need to
Unfortunately, we see Dr. Kaleya Neville being frozen. Therefore, I would like to ask in the meantime for the next intervention from Dr. Muccioli and then take a question later on for Dr. Kaleya. I hope this is fine. Dr. Muccioli, could you please take the floor? Okay. Is it us? Dr. Muccioli, could you take the floor? Then, as we do not see anymore Dr. Muccioli from San Marino connected, I would therefore, and I'm deeply sorry, hand over back and thank the two interventions so far. And Dr. Kaleya, you were frozen, so we couldn't see and hear you anymore, but we will open later on again a possibility to finish the intervention. So I would like therefore to, for the moment, being closing this panel and then later on give, when Dr. Muccioli is able to connect, the floor to him. I hand over to Chris for the next panel. Thanks.
Thanks, Bettina, and to the previous panelists. As in the world that we're in now, these kind of technical hitches happen, so we do appreciate everybody's flexibility. I have the pleasure to introduce the next panel on universal health coverage. And to save time, I'd like to introduce our four panelists today. From Montenegro, we have her Honourable Minister of Health of Montenegro, Dr. Bojovic. From Cyprus, we have the Chief Medical Officer from the Ministry of Health from Cyprus, Dr. Kalokota. We have our dear guest from Estonia, from the Ministry of Social Affairs, Ms. Kersti Esner, and from Slovenia, Dr. Andrea Vujovic from the Permanent Mission in Slovenia. So, please can I first invite Montenegro, Dr. Bojovic, please.
Hello, everyone. Special greetings to our regional director and to all dear colleagues. I would just like to excuse Madam Minister, who will be literally maybe 30 seconds late because she had a sudden call. That's why she left the conference room. If we have time, this literally 30 seconds, she is on her way. I can hear her steps. If not, then maybe we can proceed with another participant delegate and then we go back to Madam Minister, to Montenegro.
Actually, thank you very much, Mina. I think in the interest of time, if you don't mind, is the minister there? Fantastic. That's lovely. Please go ahead. Thank you.
Chris, I apologize. I thought you would say, if we don't mind, that maybe we have another delegate. I apologize.
Okay.
And then we move as a second speaker with the Madam
Yes,
Minister.
thank you. If anybody has seen the film Lost in Translation, I think this is being played out in reality. Thank you very much, Mina. So please, can I welcome our guest, Dr. Olga Kalakuta from Cyprus. Thank you.
Dear colleagues, it's a great pleasure to meet, even under these extraordinary conditions and not being able to meet physically. Until the end of May 2019, Cyprus was the only European Union state in which there was no universal health system for the whole population. The health system of our country consisted of two parallel service sectors, public and private of similar size, with significant gaps in the share of the population covered and very few interactions between the two systems. The public sector was financed exclusively by a state budget, while the private sector was largely financed by the family out-of-pocket budget. Primary target of the implementation of our universal health coverage system has always been the avoidance of financial hardship on citizens, at the same time increasing the public spending on health and also reducing the out-of-pocket payments by citizens. Cyprus was able to implement the general health system, which was one of the biggest endeavors being undertaken so far by the Ministry of Health. The introduction of the general health system ensures the improvement of the quality of the services provided and provides the guarantee for an economically viable health system, while at the same time strengthens access to health, financial protection, and address fragmentation and other inefficiencies in the health system, including waiting times for treatment in public facilities and very high out-of-pocket payments. The general health system is a comprehensive healthcare system that offers equal access to healthcare services for all citizens with the option to choose their healthcare provider from both the private and the public sector. The system covers most medical care needs of beneficiaries, including chronic, rare, and serious conditions. It provides lifelong financial protection to all beneficiaries, even for unexpected and costly healthcare needs. The right to health within the general health system is independent from the payment of contributions. Beneficiaries without an income, unemployed children, students, soldiers, have equal access to healthcare services. It is important to say that within the context of the current pandemic, the establishment of the general health system has aided public authorities in providing a more effective response through general practitioners and the overall systems mechanism. Universal health coverage, by definition, includes access to the full spectrum of services, including health promotion, prevention, and treatment. Strong health systems based on primary health care are the foundations of an effective response to COVID-19, as well as for universal health coverage. Furthermore, within the context of public health, COVID-19 testing, vaccination, and equal access to health services was provided to all eligible citizens. Cyprus has achieved universal health coverage. Looking back, collaboration between small countries can have an added value for those countries that are either in the process or even achieved it, bearing in mind the small numbers and restricted human resources capacity. Some examples that we put in front and we are ready to discuss if time allows, is discussing in relation to health system financing, bearing in mind that we are small, really small countries, and managing health data. It was already mentioned by colleagues in relation to COVID pandemic as well. Guidelines and protocols introducing evidence-based medicine. I mean, you cannot afford having an ICE, for example, or whatever. I mean, so, small countries don't have the human resources in order to work independently and isolated. Health technology assessment is again something that we can look at. As well, finally, capacity planning. I mean, most of us, at least in my country, not having a health system was something that never revealed the importance of capacity planning. And currently we have increased numbers, for example, of MRIs. We are talking about almost 500, and it's too much for a small country like us. And at the same time, not having basic specialties on some occasions of health professionals. This is from my side. Thanks a lot.
Thank you very much, Dr. Kalukuta. And I think just to say, you highlighted something very clearly there, that there has been some benefits in the pandemic around universal health coverage by looking at the spotlights of where we had weaknesses before and using this to really focus on how we really strengthen it, even when we've got good universal health coverage. So thank you very much for that point. Please, can I now introduce the Minister of Health from Montenegro, Dr. Bojovic. Please go ahead.
Honorable Regional Director, ladies and gentlemen, it is a special privilege to be a part of Small Countries Initiative. Living in a dynamic world with multiple challenges spanning geographical boundaries, in my option, being a small country in terms of population and geography size is a comparative advantage. Small countries carry the potential to be innovation incubators and paradigm of agile transformation and accelerated action to deliver on the joint European Programme of Work commitments. The past 9 months of close collaboration with Director Kluge and 4 days of very rich and productive deliberations at the Regional Committee make me feel optimistic and confident that, under visionary and inspiring leadership of Dr. Kluge and following the roadmap for supporting better health in small countries, we will be able to design and test new business models required to raise effectively to multiple challenges in terms of bringing better health to all and making the world safer. It is also clear, as Dr. Natasha eloquently stated yesterday, it is time to reshape our narrative and take pragmatic step-by-step solutions. And I would add, with a laser focus on primary health care as a road towards achieving universal health care and health security. Old problems are today's problems. Everything we were putting under the carpet hits us now. All systems have been struggling to ensure sufficient, competent and motivated health staff, but small countries have almost zero tolerance towards this challenge. We share common challenges: aging workforce, increasing demand for health professionals, more intense mobility, retention of health staff in public sector and in rural areas, need to improve in continuity skills and competencies, low wages, and very weak digital competencies. Fit for purpose healthcare system means fit for purpose, competent, improved, and motivated healthcare professionals. Dear Director Kluge, I fully agree that our strategic priority must be protect healthcare professionals who have been very often hazardous faced with burnout syndrome, which is prominent in particular now during the pandemic months, and invest in strengthening knowledge, skills, and competencies of our health staff. We together have to rethink strategic approaches and developing plans on producing, attracting, retaining, sharing, and supporting competent and motivated health and care workers together their careers, throughout their careers. We thank Director Kluge for the support announced to Montenegro medical faculty to revise and develop new curriculum to equip health professionals with functional knowledge and competencies in order to make them resilient and prepare them for times of uncertainties and challenges they would face during the future period. As we heard yesterday, our doctors and nurses are vital not only to bring quality services to every household, but they are sources of population trust and confidence, helping us shape perceptions and behaviors of our population which proved to be a critical determinant of the pandemic trajectory. During the pandemic, we have learned that digital technologies do carry a potential to complement and compensate for scarce human resources in health. The World Health Organization support, we set up a digital call center at the primary health care to bring integrated health services closer to all we need them. This was an example also of introducing new ways of shifting and effective tasks sharing between doctors and nurses. We know every coin has two sides and we have to be cautious. We must not forget that the digital technologies do carry the risk of deepening health inequalities. Therefore, only smart and tailored use of digital technologies in transition to inclusive and person-centered health care services is a way forward. With World Health Organization support, Montenegro initiated a process of rethinking health policy priorities that will be captured in the new health policy for better health and well-being in Montenegro. Investing more in primary health centers using quality data to tailor target interventions and monitor progress, and supporting resilient healthcare professionals will be a backbone of the Montenegro new health policy. The last, but not the least, appreciating the significance of the Small Countries Initiative, I would like to take advantage of this opportunity and on behalf of Montenegro government to reconfirm interest in hosting the next meeting of small countries in Montenegro. I am very much looking forward to welcoming you, dear Director Kluge, and the respective country delegates in person in Montenegro. Thank you very much for all support. Thank you.
Thank you very much, Minister Vojovic. And I believe that Hans would like to make a short intervention.
Yes,
Hans,
thank you,
please.
Chris. Definitely. I would like to express my appreciation to Excellency Minister of Health of Montenegro, Dr. Jelena Borovinic-Bojovic, for your inspiring leadership. This is a time that universal health coverage is moving in Montenegro. Under your leadership, I will never forget that we went together to the COVID-19 clinics and I saw how Minister interacted with the most vulnerable people of society, showing everything in transparency, interacting with healthcare workers, and then a great meeting with your Prime Minister, but also great relationship between Minister of Health and Minister of Innovation on digital health as well. So, Madam Minister, thank you for your recommitment to host the Small Countries Initiative meeting in Podgorica. And definitely from my side, and I know Dr. Natasha Azopardi-Mascat next to me told the same, we will be very, very happy to come. And also my appreciation to Dr. Mina Brojovic, the WHO representative. I can tell you that she's a great ambassador for your country. Thank you so much.
Thanks very much, Hans, for those words. Please now could I invite our next panelist from Estonia, Ms. Kersti Esna. Thank you, Kersti. Please join.
Thank you. Hello, everybody. Thank you for the opportunity to share our views from the perspective of universal health coverage. One of the underlying challenges for ensuring universal health coverage is the sustainable funding of health system. Therefore, I would like to share some experiences and plans related to the healthcare funding in Estonia. There are three main challenges when it comes to the funding and the universal health coverage. First, the overall level of healthcare spending is very low in Estonia. Total health expenditure is a little bit above 6% as a share of GDP, which is considerably low than the EU coverage. This means that the healthcare system is already working on the limits of its efficiency. Secondly, there is a problem of long-term sustainability of funding. In Estonia, the financing of healthcare is strongly dependent on the revenues from a payroll social tax, which makes the health insurance incomes dependent on economic cycles. The situation is exacerbated by an aging population and changing forms of work, which also have an impact on social tax revenues. Since 2017, regular transfers are made from the state budget to the health insurance fund on behalf of pensioners. However, a long-term solution is needed, and this is the reason why the Ministry of Social Affairs is preparing a plan to review the current principles of health insurance and to widen revenue base. The third challenge that I would like to point out is the health insurance coverage. Currently, not all Estonians are covered with the health insurance. Around 6% do not have health insurance coverage. In addition, the high share of out-of-pocket payments is threatening the financial protection. Nearly 25% of all health spending is financed from out-of-pocket payments, mainly for dental care and pharmaceuticals. Together with the WHO Barcelona office, we are working on an analysis on financial protection that will be published soon and will help us in proposing appropriate policy measures. We are also looking at experiences in other countries. Some changes were introduced in 2018 in the pharmaceutical reimbursement scheme that have helped to reduce the burden. We have also made some proposals to expand the health insurance coverage to the whole population, but these discussions are waiting their time because of the COVID-19 pandemic. However, we have made some little steps. For example, from this year, also uninsured population is able to participate in the cancer screening programs. We have three different national screening programs, breast cancer screening, cervical cancer screening, and colon cancer screening. And now Estonian Health Insurance Fund are reimbursing for to all people these services. Also, the costs of diagnosing and treating COVID-19 for uninsured people were covered from the state budget as well as vaccination. The COVID-19 pandemic has also had an impact leading to significant additional costs for health systems. And on the other hand, the revenues declined due to the rise in unemployment and decline in social tax contribution to health. To cover additional costs related to COVID-19, additional transfers have been made from the state budget to the Estonian Health Insurance Fund. The additional transfers from the state budget will compensate for a decline in earmarked social tax revenues and an increase in temporary sickness benefits expenditure, which has an exception in Estonia case paid by insurance fund, and are predicted to be about 8% in 2021. This is the first time in Estonia when additional funding was allocated to insurance fund to cover its budget deficits, because reserves of insurance fund were insufficient to close the gap between revenues and expenditure. Accumulated earnings, the largest component of the insurance fund reserves, have been used to cover deficits in previous years and have declined steadily. In contrast to previous changes in the funding of Estonian Health Insurance Fund, such as transfers on behalf of certain socioeconomic groups to ensure continuous and stable increase in the funding, the allocation decided during the COVID-19 crisis are negotiated as one-off decisions. The decision to cover the deficit from the state budget indicates high priority of healthcare by the government to ensure access to healthcare services. However, it does not relieve the long-standing challenge of the sustainability of Estonian Health Insurance Fund finance, and it may even postpone necessary decisions. To conclude, I believe that long-term sustainability of healthcare funding is a common challenge for all small countries, and sharing experiences in this area in the future would be very useful. Thank you.
Many thanks. I mean, highlighting some of the realities that we face as we move forward. I think that's very nicely on the table and shared by many of the countries within the network and outside. So thank you very much for that, Mr. Snar. And finally, I'd like to invite Estonia to the panel. Dr. Andrei Martin Vojkovac of Slovenia, please take the floor. Thank you.
Thank you very much, Madam Moderator. Colleagues, Excellencies, thank you for giving me the floor and also to have given Slovenia the possibility to participate in this event. And indeed, we're very happy to be able to join the Small Country Initiative and contribute to this forum of exchange. Further thanks go to all the countries in the initiative for the excellent collaboration, also for the support of the WHO European Office in Venice. As you can imagine, it's very difficult to point out only a few priorities in order for small countries to achieve universal health coverage. However, drawing inspiration from the excellent draft of the roadmap, for which we're very grateful, let me point out three topics that really stand out for us, of course, with our colleagues from the Ministry of Health, and have been a priority for Slovenia, especially during our presidency of the Council of EU. And on the first spot, it has to be strengthening the primary healthcare system. We've heard much about PHC during the session, during the RC71, and we have also adopted a very important resolution there. And we believe that for small countries, it's even more fundamental to invest into a comprehensive PHC network, as we're more susceptible to risks such as workforce shortages, including migration of highly educated and trained health personnel, geographic challenges, and limited financial resources. And when we say comprehensive PHC, we don't mean only a place where people receive basic treatment or checkups before they're being sent to the specialist, but also can receive a full package of preventive and health promotion services, including addressing non-communicable diseases and mental health. We're proud to have set up a comprehensive network of health promotion centers, which play an important role in creating a very resilient health system. However, resilient systems take a constant innovations and investments so that they're up to date and fit for purpose, which is our second priority. When talking about innovation, of course, you might think of technological, or more specifically, digital innovations, and those are definitely important and they have a part to play. We saw that especially during the COVID-19 pandemic. However, when we say innovations, we also mean innovative ways of how our systems are organized, where they get funding, what kind of partnerships they engage in. And we especially believe in strong community engagement and working with different stakeholders such as schools and NGOs. And these actors are really essential for us to reach the so-called, let's say, far parts of communities, so the most marginalized, most vulnerable, which is essential for ensuring equity. And what is universal health coverage if it's not equity? Thirdly and finally, to achieve UHC, we need accessible, affordable, and effective medicines during health emergencies and otherwise. COVID-19 aside, we especially need to improve access to essential antibiotics by overcoming the market failures and creating incentives for these essential commodities to be available to patients in a timely manner while keeping in mind the One Health approach. Another innovative approach that is, in our opinion, underutilized and underrated is repurposing of medicines, especially in oncology. Repurposing has several benefits, such as lower costs of development, lower risk of failure, and reduced time frame to registration. We agree that WHO has an important role to play in liaising between small countries and pharmaceutical industries in that regard. And we are grateful to have had the opportunity to also participate in the Oslo Initiative session yesterday, and we're very much looking forward to future engagement. To conclude, let me just say or highlight that the SCI is an excellent platform where we can exchange views, best practices that can really serve as an amplifier of the views of our collective of small countries, be it in pertinent topics such as reaction to the Monti report, or other challenges, addressing other challenges that we heard today. And we truly appreciate the Secretariat for the draft roadmap. We believe it's an excellent start to a very fruitful collaboration that we're looking forward to being guided by as we move forward together with all of you. Thank you.
Very nice to see you, and thank you very much for that intervention. We're muted. Okay, thank you very much for that. I would like to move us on now to our third and our final panel today, which is on the healthier populations. So under this pillar, I'm very delighted to invite both Luxembourg and Monaco, Her Excellency Dr. Paulette Lennert, Minister of Health and Delegate of Minister of Social Security of Luxembourg, and our colleague from Monaco, Ms. Isabella Rosso Brunetto, Vice Minister, Director General, Department of External Relations. Just to kick this off, a healthy population is the foundation of the human, social, and economic capital and resilience of a country, and therefore it's an essential investment for recovery and prosperity, particularly in small countries. So on that basis, I'd now like to hand over to Minister Lennert from Luxembourg.
Hello, do you hear me?
Yes, very well. Please go ahead.
Yes, it's Jean-Claude Schmidt here from Luxembourg. I had just Minister Lennert on the phone. She has problems to connect. So perhaps take first Monaco and we try to solve the problem.
Okay, thank you very much for that. We do hope that we will be able to connect. Please, Ms. Rosa Brunetto, could you take the floor?
Thank you, Bettina.
Thank you. Welcome.
And welcome. Yes, dear Regional Director Hans Klug, dear co-chairs, dear participants to this side event. Let me first congratulate Montenegro for its election on the permanent committee of the regional Euro. And we are proud that one of us has reached this position. I also want to thank the WHO for organizing this meeting, which allows us to take stock of how we are doing in the small countries. And more importantly, what's the way forward after this terrible pandemic? I would like to thank your team for drafting the roadmap for better health in our countries. And we are happy to see in the priorities the topics of mental health and healthy tourism, which are, of course, of the utmost importance here in Monaco. But as Mr. Klug said, small is beautiful and short also is beautiful. So with no further ado, I give the floor to Dr. Artos, which will give you an example on the recent survey we are doing here in Monaco, epidemiology. Thank you.
Thank you for giving me the chance to share this national project here in Monaco that is an inclusive project including children and adults in Monaco, aiming to inform them about their levels of protection against COVID. In Monaco, we started, as many countries, vaccination campaigns, and we are facing a difficulty that everybody does face, which is who is still protected with this vaccine? Who are the vulnerable ones? Should we vaccinate and add third doses to a whole range of population, or should we actually save this precious resource and target better who we should protect, and therefore provide individual services to our population? And as it has been said previously, we need to take the opportunity as small countries to provide maybe more accurate and personalized health services. And to be extremely brief without providing too many details, we are offering measurements, serological measurements to all our citizens, measuring neutralizing antibodies. And thanks to these measurements, that is completely free, we are therefore able to identify those who are still protected and who do not require any additional vaccination, and to differentiate those individuals to the vulnerable ones. And at age, we managed to target our vaccination campaign thanks to this national serological surveillance. We met lots of enthusiasm from our population, and this transparent information we are providing increases the trust of the population towards our governments, and we have a clear understanding that we are not simply providing vaccine regardless of the actual individual immunity, but we are vaccinating with the awareness and this information about their immunization level. So I do hope this is something we can share to all of you, as it may be a source of inspiration for future projects to target better vaccination campaigns. Thank you very much.
Colleagues, thank you very much for that intervention. We are having still a few problems while Luxembourg reconnects. So what I'm going to use the time, if we don't mind, is the opportunity to go back and give the floor to San Marino, to Dr. Claudio Muccioli, who was not able to connect for the earlier panel on health emergencies. Dr. Muccioli, would you like to make your intervention, please? We see you very well, but we don't hear you. You need to unmute yourself if you wouldn't mind. Thank you. Could the Secretariat please unmute Dr. Muccioli, please? Okay. Now, fantastic.
Okay.
We hear you perfectly.
Now,
Thank you. Please go ahead.
Sorry for my problem, PC problem. Dear directors and colleagues, the COVID-19 pandemic has dropped many of our certainties about health and show how many weaknesses in our healthcare organization. We thought that our health system were able to face up to all kinds of emergencies, that our technology could guarantee our health and that scientific knowledge could eliminate all kinds of disease. Instead, we were suddenly faced with a small enemy that changed all our lives. The small countries have been hit hard by COVID-19, both in terms of health, number of deaths, and in social and economic terms, lockdowns, traffic difficulties, and the suspension of tourism. The draft roadmap for supporting better health in small countries of the WHO European region 2022-2025, which Natasha Zopardi has just presented to us, describe very well all these critical issues and the problems that the pandemic has brought to our countries. What we learned from this experience? We learned the importance of the efficient primary healthcare system, of territorial system capable of tackling citizen health problems on the ground, the importance of the vaccination coverage over a large population in the shortest possible time, the importance of relations with larger neighboring countries, as in our case with Italy. the importance of strong leadership with good interaction between government and the medical and scientific sides. The importance of multidisciplinary action as outlined in the WHO One Health program. We have stressed the importance of strong government leadership capable of making decisions in a short time. As you know, in February, San Marino was faced with a big choice. Either start vaccinating thanks to a label of a vaccine not authorized by the EMA and the limited contagious and death, or leave its citizens in a state of great danger. San Marino became COVID-free at the beginning of June, thanks to the ability to vaccinating the short time almost of the population. We can tackle the problem with a direct action and overcome the challenges as new opportunities. The pandemic showed the importance of the territorial medicine system. During the pandemic, San Marino has created a COVID team to care positive patients directly at home. In February, the COVID team cared more than 500 patients at home, compared to 30 patients in hospital and 12 in intensive care. In conclusion, I agree with the draft roadmap for supporting health in small countries in the next 3 years. I believe that the action of just one small country might not enough, but together we could be a good reference in the global context, and we could be promoters of more effective health system. Thank you for your attention.
Many thanks, Dr. Muccioli. And on behalf of the Venice office and the WHO, we really want to say a very warm and big thanks to San Marino for the ongoing support, the Memorandum of Understanding. Thank you very, very much. Now I would like to move to back to the Honourable Minister from Luxembourg. I'm very delighted that you've been able to connect. So Minister Leonard, would you please like to take the floor? Thank you.
Well, thank you, Chair. Technology is always challenging and has been throughout the whole day today. So as the Regional Director appropriately mentioned in this highly remarkable state of health in the European region allocation on Monday, the COVID-19 pandemic has been a huge stress test for the health systems in our countries. Even if we often had intuitively an idea of the potential weaknesses of our health system, we tend to consider them as not urgently to be addressed. But the pandemic revealed these weaknesses and their paramount importance in a very clear and sometimes dramatic way indeed. Shortages of supplies and medical devices or medication, high dependence on third countries, especially for our country, regarding workforce, but also for equipments, insufficient amounts and quality of healthcare personnel with a high dependence on commuters from neighboring regions in a context of possible border closures, which we had to face, unfortunately, inappropriate levels of digitalization and the high fragmentations in the IT systems of hospitals, primary care, social security, and long-term care. All of these were for sure the main findings in Luxembourg. Our conclusion from the ongoing lessons learned process are clear. It is that we need a better health system, and as a country, we have taken already some first measures towards improvement. With very much interest, we see that the WHO Europe has also put focus on the same issues in the European Programme of Work for the next 5 years, and I want to until the 2025. And I want also to take the opportunity here to thank again the Regional Director Hans Kluge and his teams for welcoming a recent visit of a delegation from Luxembourg in Copenhagen and WHO Europe's offer to assist us as a country in various domains which we want to improve right now. So we are looking here to a very fruitful collaboration, which possibly, and I'm sure of this, can benefit other small countries identifying similar issues. Besides public health issues, the pandemic also was a tremendous stress test for the people in our countries. And we quickly learned that not all people were equal in face of the infection. The people who suffered most of the disease and deaths were the older persons, and indeed age is without any doubt the main risk factor for infection, severe disease as well as for death. In addition, people in nursing homes and long-term care are already prone to isolation, mental suffering and depression in normal times. So this was hugely amplified during lockdowns and restrictive measures such as limitations on visits of family and friends. Older people did not only suffer physically indeed, but also mentally during the pandemic. We also learned, and you know this, that people with non-communicable chronic diseases had an increased risk of infection and a poorer outcome. All common lifestyle diseases were concerned, such as obesity and diabetes, hypertension, cardiac, pulmonary diseases, cancer, to name only a few. And indeed, in our national review of the infections from 1st of March 2020 to the 31st of July of this year, we clearly found a positive correlation between the number of underlying chronic diseases and the risk for infection, hospitalization, and death. And we also have a look into the possible aggravation of the NCDs during the pandemic and its consequences. So this would be the secondary effect. We have also been looking into the influence of socioeconomic factors of the infection in a study called Santé pour tous, so Health for All. And even if we could not find directly a positive correlation between inequalities in the standard of living or salary level and the risk of infection, as was, for instance, found in other countries as the US, there were indirect indicators that socioeconomic factors might play a role. Indeed, there was a positive correlation between receiving unemployment or welfare benefits and a significant increase in the risk of infection, as there was as well a strong association between larger household size and higher risk of infection. The interpretation of this effect was that the receipt of some social transfers is associated with poor housing conditions and that larger household size mechanically leads to more face-to-face contact. On the opposite, higher salary level seemed also to protect somewhat against hospitalization. Finally, a salient finding was that some population groups with a background of immigration, even some 20 to 30 years ago, still had a significantly higher risk in infection and hospitalization. And the reasons for this are still under investigations because we found this quite strange. So in the end, the conclusion is that even in a country which is considered as a rich country with a strong social welfare system, not all people are equal in front of an epidemic. So this is just a general finding which concerns all of us. There is no doubt, and we understand, and that's what we understood from this pandemic, that besides better healthcare system, we also need a healthier population in order to be more resilient in the next health challenges to come. And this should include all parts of population as defined by age or socioeconomic factors. Luxembourg has therefore decided to develop a new national health plan, which will be kind of a roadmap for the next years, and which will tackle more specifically the tremendous challenge of NCDs. For this purpose, we define three major priorities, which are digitalization. We really think that this will be the game changer. It is mental health as well, which we consider to be under-considered generally, and it is, and that's the third one, it's disease prevention and health promotion for NCDs. I believe that with these priorities, Luxembourg will be fully aligned with the European Programme of Work from the WHO Regional Office for Europe and with the SCI roadmap. Once again, I just want to congratulate the Regional Director Hans Kluge and his team for the work program and express the full support of my country for its implementation. In addition, we look, of course, forward to a close collaboration which has been launched in our three priority domains with other small countries having similar interests. Joining forces, sharing information and experiences, and not duplicating efforts unnecessarily is especially important for small countries. So thank you very much for your attention.
Dr. Leonard, thank you very much for those words, and I think they seem to pull together and echo what the other members have said, but actually put very clearly on the table the kind of spotlighting on people who are maybe already vulnerable before, and we need to have more focus on them in moving forward. So thank you very much. I believe that Hans would like to make a short intervention. Hans, please.
Thank you, because the Minister indeed mentioned the very productive visit, and I would like to thank you, Madam Minister, for coming here with also Dr. Jean-Claude Schmitt and your team. And I think this is the new WHO we want. It's a two-way, really. because we're learning so much from all of you. And as Madam Minister says, whatever we do in a particular country is useful for another country. So one of the examples is we agreed with Madam Minister to have policy dialogue on the issue of task shifting and task sharing of the health workforce, which the small countries, but all countries, are struggling with. So this is something that for sure we'll be able to use to disseminate with all the countries in the European region. So really, Madam Minister, I want to say that we tremendously enjoyed your visit. I think we set a new stage. What we accomplished, I think in 2 hours, was incredible. But we came out with a very concrete roadmap, including, as you tell, Minister, on the mental health, because now we have to implement the mental health action framework. Thank you so much. Je vous remercie beaucoup.
Thanks, Hans.
So Hans, thanks very much. We also had on our agenda to take questions from Slido. And actually, I'm pleased there are quite some questions. Now, our time is very limited before I give the concluding remarks to Hans. So there is one question I thought was didn't come up before too much or too strongly, and this is the role of academia. Okay, if you browse down, then you can see it. So it's the second question. I mean, Dr. Muscat and Natasha, you spoke about the Innovation Hub. So how can academia be engaged into this?
Thank you, Bettina. And I think it's quite clear that we need to work very closely with academia in order to take really the debates forward and to push the boundaries. So, for example, we know that many academic centers are now beginning to see how to bring together departments of engineering, of ICT, as well as medical schools and health sciences, because this is really the future. This is where health systems are going. And undoubtedly, if we talk about an innovation hub absolutely needs to involve academia. Of course, within WHO, we do have our networks of collaborating centers, but often what we find is that we have very extensive networks in very well-established areas. And when it comes really to the new and emerging areas, it's where we need to reach out also and make new alliances and bring new players onto the scene. So that would be my perspective, that we need to go even outside our traditional constituencies and bring in players, as I said, from faculties of ICT, communications, robotics, engineering, and really work with them if we want to innovate. Thank you. Bettina, we don't hear you.
Sorry. So, does it work now? Yeah, sorry. Thanks, Natasha, very much. I just want to say there are several other questions, but we will be commenting on offline if the audience agrees, and would like to give the floor, the concluding remarks to our regional director in putting us and pushing us forward in the next months and years to come as a collaborative effort and this fantastic team of the small countries. Hans, the floor is yours.
Thank you so much. Thank you so much, Bettina and Chris and all colleagues. I'm very, very impressed by, as usual, full participation until the end. Also from our side, you cannot see probably, but we are here with a very extended team, because this is something that we are developing, the narrative, going from strength to strength, I feel, with the Small Country Initiative. Time and again, several of you mentioned the importance of having an adaptive health system, including digital health, but not digital for digital. Yes, digital innovations are very important, but we need innovative ways of how our system is organized, funded, and strong community engagement to help to reach the most vulnerable. This is the first Monti report recommendation. We need to heal the fractures in society. Who is it that we are leaving behind? Several small countries are dependent on tourism. I think Natasha mentioned it in the beginning. Healthy tourism is a key one. Small countries can be innovation incubators. And in fact, you have been demonstrating this already time and again, but we can go further in designing and testing new business models. Absolutely. COVID-19 obviously used a large amount of the health budget, which comes to the issue of long-term sustainability of healthcare funding. Small and great, primary healthcare remains very important. It's a comprehensive network on healthcare centers. I was very keen to hear the reaching out to WHO further to integrate the small country initiative with the Oslo Medicines Initiative. This is also moving at quite some pace. I mean, you all know about the Valletta Declaration, Beneluxa Initiative. Our respected health attaché from Slovenia was mentioning, right, on the I believe it was the repurposing of medicines in oncology, which was mentioned. And this is moving. The 22nd of June, I was invited at the last moment, a bit ad hoc. In fact, with Natasha, we went together to Brussels to the biopharmaceutical CEO roundtable. Every time in spring, the 20 CEOs of the big pharma meet somewhere, and this year they decided to meet in Europe because of the EU pharmaceutical strategy, and we were invited, only WHO, 90 minutes to present to the CEOs the EPW, European Programme of Work and Oslo Medicines Initiative. And after that meeting, the big pharma gave the green light to the Director General of the FPA, European Federation of Pharmaceutical Industry, and the Director General of IFPMA, the International Federation, and they came here, in fact, it was a week ago, 6 September, that we were sitting together with Dr. Björn Inge Larsen and his team from Norway to plan the next steps. And there is at least a commitment to work together on this new social pact between public and private industry towards the high-level meeting in Oslo next year in mid-June, a kind of a value-based statement. What are the principles between public and private sector to move forward to this agenda of sustainable access? And for small countries, so important, as it is just for bigger countries. Finally, thank you so much to San Marino and Minister Roberto Ciavata. We're also in constant touch for the recommitment to the small country initiative. That's very important. And we are also committed to the solidarity, including not only on the vaccine equity, but the recognition of vaccine certificates. We had some video conference where we also mediate with EU countries on recognition of COVID-19 vaccine certificates, because there should be no barrier in traveling, or no barrier for students, right, to go to university to another country because they had this a particular vaccine. And thank you again to Montenegro for the recommitment to host the 8th high-level meeting of the Small Countries Initiative. First, we are on the road to Podgorica, and then we'll go to Tel Aviv, and there will be some stops in between. Thank you so much, everyone. You're always very welcome to the UN city in Copenhagen here. This is your city, City of United Nations, this is your city. And we are also craving to come together physically and see you and hug you and touch you, but stay healthy meanwhile. Goodbye, take care.